Hi, my name is Mohammed Saad. I'm here to discuss one of the top challenges facing CIOs in healthcare, and that is improving patient satisfaction scores. So, I would like to first start by defining quality. So, ISO defines quality as the totality of characteristics of an entity that bears on its ability to satisfy stated or implied needs. If you come to think about it, quality is based on two components, that's conformance and performance. So, let's say, for example, there's two cars, both could get from 0 to 60 miles an hour in about 60 seconds. Now, for a customer to decide which one they should buy, they will attend to the quality that was provided by either car, such as comfort and luxury and so forth. And that would help complete the definition of quality from the performance standard in addition to a conformance standard. Communication is a big part of performance quality, um, and it's a big contributor to performance quality as well. There is no universally adopted communication definition. It's simply a message that is sent from a sender to a recipient to deliver a meaning. Um, there is a verbal and nonverbal component, and according to Edward Hall, 80 to 90% of communication is usually silent, um, and communication could also be delivered via text or context, and that depends on um, power distance, cultural chasms, and time culture, and so many other factors. Uh, Body language is certainly of big importance. That's open face, open hands, tone of voice, gestures, and so forth. And that really does affect patient satisfaction, and that affects how they perceive the way they are treated, and the way they perceive their own quality, and eventually um, their compliance, as we will discuss in a second. Listening is another huge component to communication. Our brains are designed to listen more than we talk, but eventually we do not exploit such skill. We should always have information and positive listening, um, which involves interactive communication, not just push and pull communication. For instance, when a patient is about to be discharged, you should not just say, hey, please refer to the discharge summary and read it, and it should have all the information. What we should do is more of an interactive communication where we go over the instructions and allow for patients or the families to ask questions, and read back what we want them to understand. All in all, the rule is that the patients do have the right to know, and they have the right to choose to make informed decisions about their health. So, how's our performance right now? According to a report from the American Academy of Family Practice, approximately 50% of adults are unable to understand printed healthcare material. About 23% of adults read at the lowest reading level, which is approximately a fifth grader or lower. The problem seems to be affected by other things such as language barriers. There is a survey of patients at two hospitals that showed that 35% of patients um, who are English speaking and 62% of patients who are Spanish speaking had fair to poor health literacy. Some literature also reports that adherence in patients is bad enough that compliance rates roughly range around 50%. A major reasons for non-adherence could be broken communication between patients and physician, leading to decreased patients' satisfaction. In some literature, poor communication with a healthcare provider was likely to cause a bad effect on patients' compliance. So what can we do? So it seems like we're dealing with a vicious circle, and for us to improve it, if we manage to improve it, it will become a virtuous circle. So definitely we need to master communication skills. We need to involve family. Some hospitals are now adopting the Patient Family Advisory Council to help them perform better, with the families being one of their guiding rails in performance. Improving communication by several methods. For example, healthcare providers should use plain language, have patients read back what they understood or did not understand. They should also encourage patients and family members to ask all the questions they want. Good communication also includes a solid handoff to other providers participating in treatment of a common patient. So arranging for timely and proper referrals. This seems to be something that does benefit a lot from IT and software technology. So if, let's say, we have a common software amongst a network of doctors, then the updates on patient's health can be seen in real time. Data from historical performance of a patient could be accessed in real time, and future alarms and messages could be sent and triggered in those softwares with little chances of failure, and that also minimizes readmissions, and this should improve patient satisfaction, especially in a environment where there is a literacy problem. Finally, the growth of telemedicine seems to be a huge potential help that will gain more popularity by time, and it's has started to be adopted by big networks in the country. Thank you. I'll be happy to answer questions or discuss feedback from anybody. Thank you very much.